Hello and welcome to Public Health Talk with Nurse Yemi. On this channel, we break down important health topics in a simple and practical way to help you understand your body and take better care of your health. Whether you're here to learn, prevent illness, or improve your lifestyle, you're in the right place. Let's get into today's topic. Today we are talking about diabetes, a condition that is becoming more common all over the world. Many people say, "I have sugar," without fully understanding what is happening in their body. So let's break it down in a way that actually makes sense. Your body needs energy to function. Every movement you make, even breathing and thinking, requires energy. This energy mainly comes from glucose, which is a type of sugar found in your blood. When you eat food, especially carbohydrates like rice, bread, yam, pasta, or even sugary drinks, your body breaks them down into glucose. This glucose enters your bloodstream. Now, your body does not want glucose to just stay in the blood. It needs to move into your cells where it can be used as energy. This is where insulin comes in. Insulin is a hormone produced by the pancreas. Think of insulin as a key. It opens the doors of your cells so glucose can enter. When everything is working well, your body produces insulin, glucose enters your cells, and your blood sugar stays within a normal range. But in diabetes, this process is disrupted. Either your body is not producing enough insulin, or your body is not responding properly to insulin. When this happens, glucose builds up in the blood instead of entering the cells. That is what we call high blood sugar. Over time, high blood sugar can damage different parts of the body. Now let's look at the main types of diabetes. Type 1 diabetes occurs when the body's immune system attacks the cells in the pancreas that produce insulin. This means the body cannot produce insulin at all. People with type 1 diabetes need insulin injections to survive. This type is less common and usually starts in childhood or early adulthood. Type 2 diabetes is the most common type. In this case, the body still produces insulin, but it does not use it effectively. This is known as insulin resistance. At first, the body tries to compensate by producing more insulin. But over time, the pancreas cannot keep up, and blood sugar levels start to rise. Type 2 diabetes is strongly linked to lifestyle factors. Gestational diabetes occurs during pregnancy. Hormonal changes during pregnancy can affect how insulin works, leading to high blood sugar. Although it may go away after delivery, it increases the risk of developing type 2 diabetes later in life. Now let's talk about risk factors. There are several factors that increase your chances of developing type 2 diabetes. Being overweight or obese is one of the biggest risk factors. Excess body fat, especially around the abdomen, affects how insulin works. Physical inactivity also plays a major role. When you don't move your body regularly, your cells become less sensitive to insulin. Diet is another key factor. A diet high in processed foods, sugary drinks, and refined carbohydrates increases your risk. Family history is also important. If you have close relatives with diabetes, your risk is higher. Age is another factor. The risk increases as you get older, although more young people are now developing type 2 diabetes due to lifestyle changes. High blood pressure, which we discussed in a previous video, is closely linked to diabetes. Hormonal imbalance also plays a role, especially in conditions like PCOS. This shows how interconnected these health conditions are. Understanding these connections helps you take a more complete approach to your health. In the next part, we will go deeper into symptoms, complications, diagnosis, and how you can manage or even prevent diabetes. Welcome back to Public Health Talk with Nurse Yemi. In this part, we are going deeper into diabetes. We will talk about the symptoms, complications, diagnosis, and how you can manage or even prevent it. One of the biggest challenges with diabetes, especially type 2 diabetes, is that it develops slowly. Many people may have it for years without even knowing. You may feel fine and still have high blood sugar levels. That is why awareness and regular health checks are very important. Let's start with the symptoms. One of the most common signs is frequent urination. When your blood sugar level is high, your body tries to remove the excess glucose through urine, which makes you go to the toilet more often than usual, sometimes even waking up at night to urinate. You may also notice excessive thirst. Because your body is losing more fluid, it makes you feel thirsty almost all the time, even after drinking water. Another symptom is increased hunger. Even though there is glucose in your blood, it is not entering your cells properly, so your body feels like it is lacking energy and keeps asking for more food. Fatigue is also very common. You may feel tired, weak, or low on energy even when you have rested. This happens because your body is not using glucose effectively. Some people experience blurred vision. High blood sugar can affect your eyes and make your vision unclear or unstable. You may also notice that wounds take longer to heal. Even small cuts or injuries may take more time than usual to heal because blood flow and healing processes are affected. Frequent infections can also occur. This may include skin infections, urinary infections, or other recurring health issues. It is important to understand that not everyone will have all these symptoms. Some people may have mild signs or no symptoms at all, which is why regular health checks are very important, especially if you have risk factors. Now let's talk about complications. If diabetes is not properly managed, it can affect different parts of the body over time. It increases the risk of heart disease and stroke because high blood sugar damages blood vessels and affects circulation. It can also affect the kidneys, leading to kidney problems over time. Nerve damage may occur, causing pain, tingling, or numbness, especially in the hands and feet. In some cases, people may lose sensation, which can be dangerous because injuries may go unnoticed. Eye problems can also develop and may affect vision if not treated early. This is why regular medical checkups are very important for people living with diabetes. Now let's talk about diagnosis. Diabetes can be diagnosed through simple blood tests. These include fasting blood sugar, random blood sugar, and the HbA1c test, which shows your average blood sugar level over time. These tests help determine whether your blood sugar is within a healthy range or not. Now to the most important part, management and prevention. The good news is that diabetes, especially type 2 diabetes, can be managed effectively. Healthy eating plays a major role. Focus on balanced meals with vegetables, fruits, whole grains, and lean proteins. Try to reduce sugary drinks like soda and processed juices, as they can quickly raise blood sugar levels. Also, reduce foods high in refined carbohydrates like white bread and pastries. Portion control is very important. Even healthy foods can raise your blood sugar if eaten in large amounts, so moderation is key. Regular physical activity helps your body use insulin better. You do not need intense workouts. Simple activities like walking, dancing, or light exercise for about 30 minutes most days can make a big difference. Maintaining a healthy weight also improves blood sugar control. Even a small amount of weight loss can help your body respond better to insulin. Some people may need medication or insulin, depending on their condition. It is important to follow your healthcare provider's advice and not self-medicate. Monitoring your blood sugar regularly helps you understand how your body responds to food and lifestyle changes. This helps you make better decisions about your health. Also, maintain healthy lifestyle habits. Get enough sleep, manage stress, and avoid smoking or excessive alcohol intake. All these factors work together in managing diabetes. Now here is something very important I want you to remember. Diabetes is not a death sentence. Many people live long, healthy, and fulfilling lives with diabetes. The key is early detection, proper management, and consistency. Small changes in your daily routine can lead to big improvements over time. Start where you are, make simple, realistic changes, and stay consistent. If you found this helpful, don't forget to like, share, and subscribe. Thank you for watching Public Health Talk with Nurse Yemi. Stay healthy and take care.